What is a bone marrow transplant for immune deficiency? Imagine a body with a weak immune system that struggles to fight off even simple infections. Sometimes, this happens because the bone marrow, which makes immune cells, doesn't work properly. That's where a bone marrow transplant comes in. It's a medical procedure that replaces damaged or faulty bone marrow with healthy stem cells from a donor. These stem cells are like blank slates that can grow into all the different blood cells, including the white blood cells that defend us from germs. In cases of immune deficiencies, especially primary immunodeficiencies, the bone marrow can be defective because of genetic problems. This means the body can't produce enough healthy immune cells, leaving it vulnerable. A bone marrow transplant gives the body a fresh start by providing healthy stem cells from a donor. These cells travel to the bone marrow and start making new, functional immune cells, helping to rebuild the immune system from scratch. The process begins with conditioning, where the patient receives chemotherapy or sometimes radiation. This step kills the faulty bone marrow and makes space for the new stem cells. It also weakens the immune system to prevent rejection of the donor cells. Next, the healthy stem cells are collected from a donor. The donor might be a family member, an unrelated person, or even from umbilical cord blood. These cells are then infused into the patient's bloodstream through a vein. Once inside, they migrate to the bone marrow and start producing new blood and immune cells. Recovery takes several weeks to months. During this time, the new stem cells engraft or settle in and begin to grow. The patient is closely watched for complications like infections or graft-versus-host disease, which happens when donor immune cells attack the patient's tissues. Despite these risks, a bone marrow transplant is often the only cure for severe immune deficiencies like severe combined immunodeficiency. It can restore both T cells, which help fight infections, and B cells, which produce antibodies. Over the years, success rates have improved thanks to better matching of donors, refined conditioning treatments, and improved supportive care. Still, risks like rejection, infections, and graft-versus-host disease remain. For some immune disorders, other options like thymic transplantation are considered, but bone marrow transplants are still a mainstay. From the immune system's point of view, this procedure replaces its core source of immune cells, allowing it to regenerate with healthy, functioning cells. This renewal helps the body defend itself against infections and can lead to long-term health improvements.